So, what is depression? Is it sadness and disappointment? While it's easy for others to say, why don't they just talk it out? So, the person who is in depression is not to be blamed. It's actually the responsibility of those with him to recognize that he's probably not doing okay and ask him if he needs help. Hello, everybody. I intend to make videos on mental health problems, and the first one is that of depression. Why depression? Because it's the most commonly heard term. It's one of the most commonly accepted diagnoses in mental health in our society. In fact, people use the term depression for all mental health problems that they might be having, and it's largely misunderstood too. So, what is depression? Is it sadness and disappointment? Is it just a name to fake one's inabilities? Is it just a sign of a person's weakness? Is it extreme boredom? No, absolutely none of these at all. It is a clinical condition, just like any other medical condition that you know of and is diagnosed with a set of clinical signs and symptoms. Depression is also diagnosed likewise. So, what are the clinical features of depression? When do we say that a person has depression? Certain symptoms and signs should be present for a period of minimum 2 weeks continuously. So, the most important is mood. The person should be having a low mood, a sadness that is present throughout the day, almost throughout the day, and for almost continuously for a period of minimum of 2 weeks. Then there should be decreased interest in activities which was pleasurable to the person earlier. Like, say, if he was interested in gardening, music, sports, all of them seem disinteresting now. There is lack of motivation to do anything that the person wants to do. Simple things like taking bath, getting dressed, going to work, all of them might seem like a huge task, which the person finds it very difficult to do. There can be very much of a fatigue, even though the person is not indulging in any physical activities. There can be poor concentration, cannot focus on anything and get the work going. There can be disturbances in sleep and appetite, which means the person can be sleeping less or sleeping more. He might be eating less or eating more. So all of these put together is what is called as depression. When it comes to thoughts, the person might be having a lot of negative thoughts. Whatever thoughts he thinks about himself, his past or his future might appear very bleak. So there can be thoughts that he is of no use to anybody, there's absolutely no worth in him, he living his life. There can be thoughts of helplessness, that he might feel that there's no help available, even though there are friends, there are family members who are probably willing to help. The person in depression feels that nobody can actually take him out of this situation. There can be thoughts of hopelessness, where he feels that there's no hope ahead and probably there's no way that he can get better, and all of that. So these are some of the negative thoughts that the person might be experiencing when he is in depression. There can be guilt, there can be low self-esteem, low self-confidence, and that is why they feel that they are unable to get out of this situation. In severe forms of depression, there can be thoughts of harming oneself, including suicidal thoughts. They would have made plans, but they will not talk about it or disclose it to anybody else. So while it's easy for others to say, why don't they just talk it out? Why don't they, overcome their problems? Why do they have to harm themselves? A person who is experiencing clinical depression finds it very, very hard to talk about his emotions and problems to others. So the person who is in depression is not to be blamed. It's actually the responsibility of those with him to recognize that he's probably not doing okay and ask him if he needs help. So there are two kinds of depression. One is called reactive depression, which people understand very well. Like, there is a stress, and as a reaction to stress, the person goes into depression. This is easy for people to understand. Whereas there's another kind called endogenous depression. Endogenous means from within. It's biological. It can happen absolutely without any cause. This is very hard for people to understand, that some person, even though might not be having any form of a stress when you look outwardly, can still go through clinical depression. It's important to understand this because this is somewhere we do a mistake and we say, he doesn't have any problems, what's the reason to be depressed, he's just faking it and all of that. So it's important you know this, you recognize if this is happening to somebody else and help them out. So once a depression is diagnosed, what do? There are a lot of treatments available. There are medications called antidepressants which can be given. In mild to moderate cases, there are also a lot of psychological interventions that can be done. Psychological interventions do not mean that a counselor or a therapist is just saying, don't be negative, start doing things, just come out of depression, your life is very bright, just see that. So this is not the way in which counseling is done. This would have been told by many people to him already, and that is not counseling. There are very structured methodologies in which psychological interventions are done, and therapist is trained to do so. I'll talk a little bit more on the kind of interventions that we can do in my next video. But if you have watched this video and if you are experiencing any of these symptoms or might experience in future, please do take help. Depression is treatable. It's very, very common. 1 in 5 people have depression, which means it's as common as things like diabetes and hypertension. So there is nothing to feel bad about it, and it can be treated. If you happen to come across anyone else who can be probably going through these symptoms, instead of saying you are just seeing it negative, you can overcome it, just try hard, be strong, and then all of this will be over, rather than saying things like this, please encourage them to take a proper treatment. Thank you.